On this edition of Veterans Health Watch, we'll learn about the VA volunteer program and the crucial role that volunteers play in accomplishing the VA mission of serving our nation's heroes.
We'll also discuss ways to contribute to projects that enhance the lives of hospitalized veterans.
Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm your co-host, David Edwards, and we're happy to be joining you here today at our new set.
And I'm Kenya Griffin. Annually, we like to do a show that focuses on VA volunteering and fundraising, just to keep our audience abreast of how they can honor veterans who are hospitalized throughout the VA Maryland healthcare system. And joining us today to give a national perspective of the VA volunteer program is Sabrina Clark. She is the Director of Voluntary Services for the VA Health Administration. So, Sabrina, thank you for joining us today.
Thank you. It's nice to be here.
And I understand the VA has one of the largest volunteer programs throughout the federal government. Can you tell us about how many volunteers do you have in your program and how many hours they contribute?
Absolutely. And VA does have one of the largest integrated volunteer programs in the federal government. Annually, we have, just in the last fiscal year, had over 140,000 volunteers contributing 11 million hours of service. We have been in existence since 1946, and over the full course of time, that's been 750 million hours of service. So it is amazing what our volunteers are doing for VA.
That is impressive.
Yeah, those are really impressive figures, Sabrina. Can you also tell us about the mission of the VA Voluntary Service? What is specifically the mission of the VA's Voluntary Service program?
So I'll try to keep it pretty simple, but in a nutshell, the Voluntary Service program is a way to supplement the care and treatment of veterans through the resources and collaboration of individual volunteers and community groups that work to serve the mission of VA.
And why would you say that VA volunteers are so important to the health care and the support we provide for veterans?
Well, I think a couple of things, or actually three. I would say one, the importance of volunteers is that they are representatives of our community. It shows that we are a community that cares about veterans and remembers their service. Two, it's an opportunity for us to do just one more thing. I like to say just the extra touch, the extra service, the added value that we can bring to our already excellent health care. And three, it allows us to bring individuals into a space where they can try on new skills, try out a new talent, and really contribute to a worthy mission.
And Sabrina, I understand that the VA Voluntary Service Program successfully partners with a number of organizations and groups to help in the service of our nation's veterans. Can you tell us a little bit more about these partnerships?
Absolutely. In addition to individual volunteers, we could not do what we do without some of those community groups. In total, there are approximately 740,000 national groups that we are working with across the country to bring volunteer resources and donations to VA. We also have a national advisory committee that's comprised of about 55 veterans organizations, other service organizations, community groups that help ensure that we can create the best environment possible for a volunteer or an individual group that wants to be a part of our healthcare system. So they help us to make recommendations up to the secretary and create an environment where our veterans continue to get world-class healthcare, which is what they've come to expect and deserve.
And Sabrina, many of us learn about service to others at a very young age. Are there age requirements or age limitations for volunteering with the VA?
And I think the easiest way to answer that, Kenya, is that It depends on the assignment. So there may be very young volunteers that come and serve in collaboration with their family or a school group. There may be youth volunteers that are coming as part of a summer youth program where there are assignments that have been specifically designated for them, or they come as part of a group. Perhaps it's a scouting group or a church group or a school group. And then there are individual adult volunteers at any age that are coming to bring their service and skills and talents to the volunteer world. So I guess I would say volunteers at any age are welcome, and what we work to do as an organization is find the best fit for them.
Excellent.
Sabrina, you mentioned the resources that the VA Voluntary Service Program also is responsible for. Can you tell us about that program a little more? I understand the VA Voluntary Service Program is also responsible for administering gifts and donations to VA medical centers. Can you tell our audience exactly how that program works?
Absolutely. In addition to the volunteers, you're right, the gifts and donations that come into VA help us to supplement that health care even further. Last year, we had over $86 million worth of gifts and donations that come in. And those may be monetary donations or in-kind donations where people bring in services that have value that we can give to that again help us to do just a little bit extra for our veterans within our facilities.
Very good.
And can you tell us about some of the special programs or projects that are sponsored specifically by the VA Voluntary Service Program?
Yes. So I think I'd like to split that up into programs and maybe events. So we have some special programs within VA Voluntary Service, like our National Salute. I bring that up first because it just passed recently. So our National Salute to Veterans is an opportunity specifically, it's unique to VA, and it allows us to really honor our veteran patients. So individuals can come in and contribute to that. We have volunteer programs that run pretty much nationally, like our Volunteer Transportation Network, where individuals can volunteer to help bring veterans to and from their medical appointments to VA facilities. I mentioned our Student Youth Volunteer program previously in the last question. That is ongoing in many of our facilities, corporate volunteer programs that exist. As far as special events, there are a lot of national events like our Disabled American Veterans Winter Sports Clinic, our national games such as our Golden Age Games, or our Creative Arts Festival, our wheelchair games. And I know I'm probably leaving out a couple, but there are a number of national events and other events for specific programs, such as Stand Down for Homeless Veterans, and then our Welcome Home events for returning veterans. So there are a number of activities and events and special programs that give people to contribute in any number of ways to the work that we're doing at VA.
It really sounds like the VA Voluntary Service Program is doing so many wonderful things to support the needs of our nation's veterans, so that's great. So for our viewing audience today, if we have community members who might be interested in becoming a volunteer, can you give us some information about what is the benefit of being a volunteer? Why is it important for them to give back? And what can they walk away with from being a volunteer for the VA?
Yeah, I think I would begin by looking at VHA's new framework for our strategy, Honoring Service, Empowering Health. That is part of our strategic plan now for the Veterans Health Administration, and I think it's a great summary for what we do in voluntary service and what the opportunity is for individuals that want to help us honor the service of veterans. I think there's no greater way to honor the service of veterans than by serving them yourselves in a way that only you can do. Because individuals have an opportunity to bring their unique gifts and talents to an already stellar healthcare system, there is a great opportunity for them to actually contribute, to empower health, contribute to the health care of our veterans. And what we know about volunteering and giving back is that it also promotes your positive health, that you live longer, live a happier and healthier life by giving back. So again, if you're interested in doing that one more special thing for veterans, why not consider VA as a place to do that? So individuals can get information about volunteering from their local VA medical center, or they certainly can look online and contact the national office at volunteer.va.gov.
And what about for the members of our viewing audience who are interested in volunteering? Maybe they don't have the time or the resources, but they want to donate monetarily. How can they find out more information about giving a monetary donation?
Yeah, same thing. I would encourage those individuals to really reach out to their local VA medical center. The voluntary service staff there will have a list of needs and what's really needed and how donations can support particular functions or programs or services at the VA. So I would encourage them to make that their first stop, is to their local VA medical center.
And they can find their local VA medical center at va.gov.
And Sabrina, before we go to a break, can you tell us anything else you'd like to let our viewing audience know about the VA voluntary service program throughout the country?
I think if I had anything, a final word to say, is that there is a tremendous dedicated core of voluntary service staff members who are there waiting to provide the best opportunity for anyone who has an interest to serve. I think that in Kenya's question of what do I have to have, a special skill, be a certain age, I would say bring your desire, bring your passion, bring your energy. And if you bring that to VA, we have a dedicated core of team members who are saying, how can I put this energy, this passion, this special skill, this talent to work on behalf of veterans? So my real message is, if you're looking for a place to serve, consider VA. If you're wondering when's the best time to get started, consider doing it now. It's a great organization to be a part of.
Sabrina, thank you so much. Wonderful. And we thank you for being here today. We're going to take a short break, but when we come back, we're going to be learning more about the VA Voluntary Service Program throughout Maryland. So stay tuned.
Our veterans put everything on the line to protect our freedom. We may never be able to repay them for their sacrifice, but we can show them just how much we appreciate all they've done. Every day, hundreds of people just like you volunteer to help our veterans. You can help by simply sharing your time, lending a warm smile, a supportive hand, or a sympathetic ear to someone who needs it. Everyone can do something to make our veterans know how much we appreciate their service. What will you do?
Those veterans who don't enroll in care, many times if you ask them if they're a vet, they'll say, no, but I did serve in the military.
Anyone that made that commitment to put your life on the line for others is a veteran.
The system is very accessible. For instance, enrollment. We have 3 ways to enroll.
You can enroll online, you can physically go into the VA and enroll, or you can telephone to enroll.
Doesn't cost anything to enroll. All it takes is a few minutes of your time and a copy of your DD-214. That's all you need.
I'm a veteran myself. And I tell the family, when you entrust the care of your loved one to me, you can go home safe and very at ease.
Best thing that you can do is just come in and apply.
Without a doubt, any veteran definitely owes it to themselves to enroll. You know, your health and well-being is priceless.
Welcome back to Veterans Health Watch. Joining us now to talk about the VA Voluntary Service Program throughout the VA Maryland healthcare system is Susan Kern, Program Manager of Voluntary Service. Susan, thank you for joining us today.
Well, thank you. I'm glad to be here.
Susan, in our first segment, we were talking about the VA National Voluntary Service Program. But can you tell us how the volunteer program is operating throughout the VA Maryland healthcare system to support the needs of our hospitalized veterans?
Sure. So the VA Maryland healthcare system, for anyone who doesn't know, is an integrated healthcare system. And we have 3 inpatient facilities. We have 6 outpatient facilities. And fortunately for us, we have volunteers in all of those locations. And that's really wonderful. From our smallest outpatient center, we might only have 6 or 7 people there, but we have people there to our larger ones where we might have 275 volunteers on our rolls that are active, and that's really great. You listen to those kinds of numbers and you think, well, golly, they probably don't need more people. That's far from the truth. We have so many areas that we cover with volunteer support, and volunteers bring a really different mix to the hospital setting versus a paid employee. So with our volunteers, we always do supplemental type of positions, and we also do things that are very customer service focused.
And so what are some of the requirements for being a volunteer with the VA Maryland Healthcare System?
Well, I like to think that our requirements, even if you think they might be strict, are important because we are taking care of very precious people, and that's our veterans. You do have to fill out an application, which the application itself isn't hard, but there are some things that we do. We do a background check on all of our prospective volunteers, and some places do background checks, but we actually fingerprint our prospective volunteers, and we do have some people that don't pass the test. And personally, being a woman that has an 89-year-old father that is a World War II veteran, I like to know that not just anybody can come in and be a volunteer. We do have standards, and we stick by them. So that's the application, the background check, and then we move into the next part. Once you pass those things, then it's all about training. It's our general orientation, so you learn about being a volunteer and what that's all about, and then you also will have more on-the-job training for the particular position that you're assigned to.
It's good to know how seriously the VA Maryland Healthcare System takes its voluntary service program.
Mm-hmm.
Susan, for volunteers who may not be able to give a lot of time, they have limitations on what they can do, are there other opportunities for them to provide support throughout the VA Maryland Healthcare System?
Well, yes, there is. I would like to mention, though, that, our commitment that we do ask of individuals that want to come and volunteer is only 100 hours, and that's very attainable by most people. But there are some people that, as you ask the question, just can't do that. And so we have a category that we call occasional volunteers. Our occasional volunteers are mostly group related. They're people that come in, a group from 2 people to 22 people and make a visit, and you don't have to put in the time that we ask of our regularly scheduled volunteers. With them, of course, we're looking for a normal schedule, and I say it that way in that we don't say to people, you have to volunteer 4 hours a week or you can't be a volunteer. You could volunteer 1 hour a week. It's the consistency in a regularly scheduled volunteer versus an occasional volunteer who might come in on a quarterly basis.
And you mentioned that the VA Maryland Healthcare System is a large system, so you have volunteers throughout the state. Are there specific areas in the healthcare system that need volunteer support?
There are certain areas that always need volunteer support. For example, our volunteer transportation program, which is a great, it's a wonderful program. It was set up years ago to help people that had difficulty getting in for their appointments. We actually have volunteers that go out in government vehicles, pick them up, bring them in for their appointments, and then take them home. Always need drivers. Always need good drivers, though. So we're looking for people that, have a driver's license and are insurable and all that kind of stuff. But we also have some, I mentioned that in one of our big focuses is customer service. So we have a lot of programs where we want to have people that are have good personalities, are friendly, and are there to help our veterans, such as our greeter program. Greeter programs work in a number of different ways. In some of our facilities, you might find what we call a greeter at the information desk. They might be at a strategic place throughout the hospital where somebody coming in might need some directions, things like that. We also have volunteers that help in a really nice program in 2 of our facilities that is called Silent Nights, and it's a program to help our veteran patients in the evening time to be able to wind down, maybe catch a good sleep for their own well-being. And we have volunteers that go around and they give them some shades for their eyes. They offer them some warm milk. They give them a cassette player that has very soothing music. So that's an example of another customer service focused position that we might need. We have a lot of volunteers in some of our specialty areas, women's health, volunteers that help with homeless, the entire arena of homeless veteran program. And we do have some volunteers that help with our OIF and OEF, which is Operation Enduring Freedom and Operation Iraqi Freedom, that help in that area as well. And don't ever, ever, ever forget our wonderful volunteers that work on the medical surgical floors in our hospitals and in our regular nursing floor areas, because without them, the one-to-one and the errands and just talking with our veteran patients wouldn't necessarily happen.
Sounds like an impressive program, but we're going to take a short break. Stay tuned for more information about the voluntary service program throughout the VA Maryland healthcare system.
The VA Maryland healthcare system is the overall healthcare system for veterans in the state of Maryland.
We have 3 inpatient locations as well as 6 community-based outpatient clinics.
And the treatment that I've received from the Maryland VA healthcare system, it's been top-notch, definitely cutting edge.
I think what makes the VA innovative is constantly exploring new ways to become more efficient and more effective. We were the first hospital in the world to make the transition from film-based radiology to filmless radiology.
We measure everything we do. We are always keeping track of our ability to deliver the standard of medical care to all our patients. We have the most committed, diverse, and caring group of professionals.
You know, a lot of us have served in the services. These guys and these ladies, I mean, they're everything to us. And there's nothing I would not do for them.
Welcome back to Veterans Health Watch. Susan, in our previous segment, we were talking about the gifts and donations program at the national level throughout the Department of Veterans Affairs. Can you tell us a little bit more about the gifts and donations program throughout the VA Maryland healthcare system?
Sure. So basically, there's 3 ways you can give, if you will. Monetarily, a monetary donation, an in-kind donation, or a donation that is associated with an activity.
And so what sorts of programs and services are supported by these donations?
All kinds of, we have a lot of what we call general post fund accounts, and our monetary donations go in to support them. They include things like women's veterans, homeless veterans, the returning veterans fund. Our greatest need is in our all-purpose accounts, where we can really use any of those funds to benefit needs of our veteran patients.
Excellent.
And if there's somebody watching the show today and they want to make a contribution to support the needs of hospitalized veterans throughout the VA Maryland healthcare system, what can they do?
Well, the best thing to do really is to call one of our voluntary service offices, because our staff knows what the needs are throughout the entire healthcare system. And with people's monetary donations as well as their in-kind donations, you know, I know that people want to give to what's needed. So make that phone call and we can help guide you to what is needed right at this moment.
And people are always looking for a convenient way to do everything, including give. So you have the eDonate online program now. Can you tell us a little bit more about that?
And boy, has that been a nice thing. It's fairly new, and all you have to do if you want to give a monetary donation, go on the web page, and e-donate is its own little button, and just push that. It's very simple to fill out the paperwork involved, and then there will be actual listing of designations of what your money can be used for, and you can select.
You can see exactly where your money's going.
Yeah, that's
excellent.
great. Susan, can you also tell us about in-kind donations as well as donations that are in the memory of a loved one?
Sure. In-kind donations, of course, are all the array of things that we're able to give to our patients above and beyond, and that includes things from socks, comfort items, blankets, and along with in-kind donations, I mentioned about activities. So activities could be perhaps a birthday party, and the organization is bringing in the beverage and the cake and the cups and the plates and all that kind of stuff. As far as memorials, we do encourage people to take that route, and what would happen is designate VA, Maryland Healthcare System, for memorials. The money would come in, and they should designate it who it's in memory of. And then we get a hold of the family, let them know that, X number of dollars have come in memory of their loved one, and give them the opportunity to choose where that money would best serve our veteran patients.
And to briefly tag on to that question, what about those community members or veterans who want to give part or all of their estate to the VA Maryland Healthcare System? What should they do?
Wouldn't that be a lovely gesture?
Yeah.
Well, it's a little more complicated. So what I'm going to say is they can call our offices, but we absolutely go through our legal services and get guidance on that. They're really the people that take care of that type of thing. So someone would certainly want to speak with their own attorney as well, and then but we like bequests, and we've had several really nice ones in the past couple of years. So, but I would definitely speak with an attorney.
Susan, thank you so much for joining us today. Really a lot of wonderful information about the VA Voluntary Service Program throughout Maryland and the Gifts and Donations Program. Well, that wraps up another show for us. Thank you for joining us for this edition of Veterans Health Watch. If you have questions about today's show, or you'd like to make suggestions for future topics, please give us a call at 410-605-7101. You can also visit us online at maryland.va.gov or on Facebook or Twitter.
If you're a veteran or you know a veteran who is not enrolled for VA health care, please call us at 1-800-463-6295, extension 7324. Visit us on the web or come and visit one of our medical centers. We'd love to serve you. Please join us again next time.
As a nurse, it's very important for me to see a friendly face when I come into the hospital.
I really didn't think I was qualified because I didn't have a service-connected disability.
Recognized for its state-of-the-art technology and quality patient care, the VA Maryland Healthcare System is a progressive organization that provides a full continuum of care to veterans. The VA Maryland Healthcare System is committed to serving the needs of veterans at 8 locations throughout the state.
At the VA Maryland Healthcare System, we're proud of our investment in technology because it's an investment in our veterans.
The categories of care have been opened up so that more veterans can qualify.
Tell a vet to call 1-800-463-6295 extension 7324 to inquire about enrolling in the VA Maryland Healthcare System.
When I came home from my military service, I knew that I needed help, and I went to the VA and they were there for me.